Good day, ma'am. I am Rachel May M. Morales, BSN2 Section A. Today, I am going to perform initial care of the newborn. So for the assessment, first, we're going to inspect the condition of cuticles and hands for cuts, open lesions, or abrasions. Then we're going to check the fingernails per procedure. Second, we're going to check the vital signs of the mother and monitor the fetal heart tone. Third, we're going to monitor the progress of labor by palpation of the abdomen for frequency, duration, and intensity of labor contractions. Then lastly, we're going to check for perineal bulging. Good morning, ma'am. I'm Rachel May Morales, ma'am, and I'll be your student nurse for today. So ako lang i-check imong BP, ma'am, ha? Okay, so normal lang, ma'am. 120/80. For nursing diagnosis, it includes risk for infection, risk for maternal injury, and risk for fetal injury. Related factors are individualized based on patient's condition or needs. In planning, we're going to identify expected outcomes following completion of procedure. No break in surgical technique will occur and patient is not exposed to microorganisms. Second, we're going to prepare for surgical hand washing, alert personnel or treatment area that scrubbing is to begin. Then we're going to prepare the client for delivery and provide initial care of the newborn. Now, the implementation. The immediate care, the first 90 minutes. Time bond and perineal bulging with presenting part visible, which is the second stage of labor. So first, we're going to identify the patient. Good morning, ma'am. I am Rachel May Morales, ma'am, and I'll be your student nurse for today. So ako lang i-check yung mga wristband, ma'am, ha? Okay. So, pwede na maisulti yung ngalan, ma'am? Birthday?
Girly Morales, March
Okay,
9,
ma'am. So,
1980.
kapila naman ni mo ron nga baby, ma'am, kanang may ipanganak ron, ma'am.
Pinakauna na ko.
Oh, first baby, ma'am. Okay, ma'am. Thank you. Next, we're going to ensure the woman's privacy and then assist the woman in the lithotomy position. Then we're going to arrange the materials and supplies in a linear sequence. So we have here our sterile pack that contains the linens, forceps, sterile cotton balls, scissors, then the plastic lamp and 2 metal balls. Then we have here in another sequence our alcohol, the stethoscope, the eye ointment, vitamin K, Hep B vaccine and BCG vaccine, then the syringes. Then we also have here our cotton balls, tape, and sterile gloves. Then we have here another materials such as the diaper, the bonnet, the dress for baby, and pranala. Then we also have here the weighing scale, the baby's chart, the ball pen, then rectal thermometer, tape measure, our stomach pad, the ankle band, and the identification card. And now, we're going to prepare for the delivery and ensure that delivery area is draft-free and between 25 to 28 degrees Celsius using a room thermometer. So we already wash our hands surgically and double glove just before the delivery. Time bond within the first 30 seconds at the time of delivery. We're going to encourage women to push as desired. Drape the sterile, dry linen over the mother's abdomen in preparation for drying the baby. Then we're going to apply perineal support and control delivery of the head. Call out the time of birth. Baby girl at 5:30 p.m. Dry and provide warm. Use a clean dry cloth to thoroughly dry baby for at least 30 seconds, starting from the face and head, going down to the trunk and extremities. Then we're going to remove the wet cloth. Do a quick check of newborn's breathing while drying. So note, during the first 30 seconds, do not ventilate unless the baby is flappy or limp and not breathing. Do not suction unless the mouth and nose are blacked with secretions or other material. Time bond if after 30 seconds of thorough drying, newborn is breathing or crying. Do skin-to-skin contact. If a baby is crying and breathing normally, avoid any manipulations such as routine suctioning that may cause trauma or introduce infection. Place the newborn phone on the mother's abdomen or chest skin to skin. Cover newborn's back with a blanket and head with a bonnet. Place identification band on ankles. So note, do not separate the newborn from mother. As long as the newborn does not exhibit severe chest injury, gasping or apnea, and the mother does not need urgent medical stabilization. Do not put the newborn on a cold or wet surface. Do not wipe off vernix if present. Do not bath the newborn earlier than 6 hours of life. If the newborn must be separated from her mother, put her on a warm surface, in a safe place close to the mother. Time bond, 1 to 3 minutes. Do delayed or non-immediate cord clamping. Remove the first set of gloves immediately prior to cord clamping. Clamp and cut the cord after cord pulsations have stopped, so typically at 1 to 3 minutes. Put ties tightly around the cord at 2 cm and 5 cm from the newborn's abdomen. Cut between ties with sterile instrument. Observe for oozing of blood, so note, do not milk the cord towards the newborn. After cord clamping, ensure 10 IU or IM is given to the mother. Time bond within 90 minutes. Provide support for initiation of breastfeeding. Leave the newborn on mother's chest in skin-to-skin contact. Observe the newborn. Only when the newborn shows feeding cues, such as opening of mouth, tonguing, licking, rooting, make verbal suggestion to mother to encourage her newborn to move toward the breast, such as nudging. Counsel on positioning and attachment. When a baby is ready, advise the mother to ining magpatutoy ka, ma'am. Ang baba sa bata, ma'am, dapat naa sa imong areola, ma'am. Dapat ang iyang ilong, ma'am, naa sa imong opposite nga side, ma'am. Ang iyang bingo na sa imong tutoy o atubang ang bata nimo, ma'am. Ato pong panigaraduhon, ma'am, nga ang liog sa bata, ma'am, dili mahiwi or mapiko, ma'am. Ato pong kaptan ang atong bata, ma'am, duol nato. Ug atong suportahan, ma'am, ang tibok lawas, ma'am, dili lang ang liog ang shoulder sa bata, ma'am. Tapos okay ra na, ma'am, if wala pa kaayoy gatas ang imong tutoy, ma'am, kay naman tayo ginatawag nga milk code, ma'am. So dili ta pwede diri magpa tutoy, ma'am, gamit ang bidbiron, ma'am. So okay lang na, ma'am, bahalag gamay lang sa ang mugwas nga gatas ni moron, pero isige lang nato patutoy ang bata, ma'am, para mo stimulate sad na, ma'am, di magkadugay magka daghan na yan na, ma'am. So note, health workers should not touch the newborn unless there is a medical indication. Do not give sugar water, formula, or other lacteals. Do not give bottles or pacifiers. Do not throw away colostrum. For visibly small newborn or a newborn born at least 1 month early, encourage your mother to keep small baby in a skin-to-skin contact with her as much as possible. Provide extra blankets to keep the baby warm. If the mother cannot keep the baby skin to skin because of complications, wrap the baby in a clean, dry, warm cloth and place in a cot. Cover with a blanket and use a radiant warmer if room is not warm or baby is small. Do not bath the small baby. Ensure hygiene by wiping with a damp cloth, but only after 6 hours. Postpone bathing until after newborn is at least 6 hours of age. Prepare a very small baby or a baby born at least 2 months early for referral. Do eye care. Administer erythromycin or tetracycline ointment or drops to both eyes after newborn has located the breast. Do not wash away the eye antimicrobial. Essential newborn care from 90 minutes to 6 hours. Time bond from 90 minutes to 6 hours. So we're going to give vitamin K prophylaxis. Inject a single dose of vitamin K milligrams IM. Inject hepatitis B vaccine intramuscularly and record. Thoroughly examine the baby. So we're going to look for possible birth injury, bumps on one or both sides of the head, bruises, swelling and buttocks, abnormal position of legs, or asymmetrical arm movement or arm that does not move. So if present, we're going to explain to parents that this does not hurt the newborn. It is likely to disappear in 1 week or 2 and does not need special treatment. Then we're going to gently handle the limb that is not moving. Do not force legs into a different position. And look for malformations such as cleft lip or palate, club foot, old looking or unusual appearance, open tissue in head, abdomen or back, and if present, we're going to cover any open tissue with sterile gauze before referral and keep warm. Refer for special treatment or evaluation if available. So now let's do cord care. So we're going to change gloves to sterile. Put nothing at the stump, apply alcohol to the cord stump and the inner rim of the skin cuff surrounding the base of the cord. So note, do not bandage the stump on abdomen. Avoid touching the stump unnecessarily. Place tape measure around the head, encircling the forehead over the brow, the chest, abdomen, and the occiput to heal, keeping the baby's body as straight as possible. Head circumference 28 cm. Chest circumference 27 cm. Abdominal circumference 25 cm. Length of baby 40 centimeters. After that, we're going to weigh the baby. Weight of baby 2.5 kilograms. dress and wrap the baby. Take rectal temperature for 1 full minute. Repeat taking temperature after 5 minutes if neonate's temperature is below 36 degrees Celsius. If the baby has low temperature, wrap the baby securely with blanket. So the baby's temperature now is 36.6 degrees Celsius. Place stamp pad over 1 foot at a time. Leave foot marks on baby's chart, making sure that all 5 toes are visible. Wipe the baby's sole with sterile wet sponges, and then wrap the baby and tape the identification card at the blanket. So we're going to write the measurements, weight, rectal temperature, time and date delivered, name and mother of baby. Then we're going to do aftercare of equipment use. Remove gloves and perform hand hygiene. Complete the baby's chart. Endorse to nursery nurse or any staff nurse. Include the procedure done such as initial care, crits prophylaxis, cord care, vitamin K, and hepatitis B. And lastly, we're going to record or chart procedures and observations.